My name is Erika Seehafer.
And my name is Kayla Morris.
And today we are going to be talking about innovative medicine in Uganda.
So where is Uganda located? I'm sure most of you know that Uganda is located in Africa, but it's about in the eastern area of Africa. And so when you zoom into Eastern Africa, Uganda is located next to Kenya. And then if you zoom into Uganda, we were in Kabale, Uganda, which is down next to the Rwandan border.
While we were in Uganda, we were working with an organization called KIHEFO, which stands for Kigezi Healthcare Foundation. KIHEFO is a nonprofit, non-governmental organization that was founded by Dr. Geoffery Anguyo in 2001. KIHEFO consists of a group of clinics, which includes a general clinic where they see all sorts of patients, a dental clinic, an HIV/AIDS clinic where they see patients that either need to be diagnosed with HIV or AIDS or are getting treatment for that, a nutrition rehabilitation center where they work with orphaned and vulnerable children that are malnourished, and a maternal children clinic. Other programs that KIHEFO runs include a rabbit project where they hand rabbits out to community members so that they have a sustainable food source as well as a way to make an income. They also work with outreach clinics while people are visiting and working with KIHEFO. So KIHEFO's mission is that they believe that poverty, disease, and ignorance are all interconnected. Therefore, they all must be addressed to break this cycle of poverty and impoverishment in Uganda. So based on this philosophy, KIHEFO pursues a holistic and participatory approach to community development. They use a bottom-up approach using individual people and village groups to give the necessary care, resources, and tools to become healthy, productive community members. So their goal of the foundation is to educate and empower people to gain control over their lives and to have a positive lifestyle. So to do this, they work in partnership with local, national, and international programs, communities, institutions, and individuals to build that mutually beneficial relationship to sustain the community members and the foundation.
So why would you want to go to Uganda? This is a question that we all received multiple times. And some reasons that people thought we wanted to go to Uganda were to watch medical professionals, and other reasons were to see leopards, or to go on hikes, or to look at baby pineapples, or to eat chapati, or to look at elephants, maybe to get stuck in rainstorms, or maybe even to cross the equator. And while these are all great reasons to go to Uganda, the real reason we went to Uganda was to learn. And so we spent a lot of our time at multiple different community outreach clinics, and we got to participate by taking blood pressures or assisting in the pharmacy. A lot of things we did was like holding flashlights while the dentist would extract teeth. And so everything we did was within a scope of practice that you would want here in America. We were not doing anything that would be outside of our scope of practice. And so we really just learned how the doctors in that town and organization interacted with community members and the common complaints that came in. So a lot of people had like acid reflux pain or headaches or lower abdominal pain. And you would see that in each community. Lots of people had the same complaints. And so one of the cool things that we got to witness was the removal of glass. And so a patient came into a community outreach clinic stating that he had been in a motorcycle accident 6 months prior, and everything had healed except for his leg. So the doctor went and got 2 gloves, one for me and one for him. And he had me feel the left side of his leg while he felt the right side. And as I was feeling his leg, I felt something underneath the skin. So I alerted the doctor, and he felt it as well. And then he called in his colleagues to help kind of discuss the next steps. And since we didn't have access to an x-ray machine, there was no way to x-ray it and know what was under the skin. And so they decided to remove it like a Nexplanon on birth control, which is just by making an incision and kind of pushing it out. So after some deep incisions were made, they finally removed the piece, and it was a triangular piece of glass. And nobody expected it to be triangular. So some issues and lack of resources that were used was they had no skin prep. So in America, before you have any procedure, they would use something called chlorhexidine to prep the skin. And we used hand sanitizer. And then there was no anesthetic. So we went to the dental clinic and grabbed a 2 milliliter syringe of lidocaine, and that was all the anesthetic this patient got. And then the surgical equipment, it was in sterile packaging, but the sterile packaging had been opened before, so it was no longer considered sterile, but the instruments were clean and they grabbed out what they needed. And then the gauze and cotton swabs, there just wasn't very many of them, but they used what they had and could use. So in the top picture, you might notice that there's a lot of people hanging around the one patient. So the guy in the white cloak is what's known as a medical officer, and that basically means that he went to medical school and then completed a surgical residency, so he is able to diagnose, treat, and do surgical procedures. The woman in the white coat is a physician assistant, and she was just watching and observing, but like physician assistants in America, she very well could have done this procedure. And then the guy in the back, who's kind of hard to see, he is a clinical officer. And he's the doctor that I was working with originally. So a clinical officer is a doctor that has not completed a surgical residency, so he can diagnose and treat, but cannot do anything surgical. So he did have to extend his hand out to his colleagues to have them do this procedure. Another innovative thing is Pap smears. And so just an overview of what a Pap smear is. Pap smears assess cells from the cervix, checking for abnormalities that can develop into cancer. And so cervical cancer is the 4th leading cause of death by cancer and the 4th cause of cancers worldwide. So women 21 through 65 should receive a Pap smear every 3 years unless they've had abnormal Pap smears in the past. And so in America, basically they insert a speculum and they get this brush and they swab your cervix, and then they send it off to the lab, and within a week you have your results. Well, the issue with this in Uganda and other third world countries is that it's really expensive and it takes time to smear and interpret the results. And most people don't have phones, so it's really hard to get a hold of them afterwards. So the alternative that was used is very cost effective and it's easy to use, and the visual changes are immediate. So they used acetic acid, which is just standard vinegar, and they soaked it on a cotton swab and then swabbed the cervix. And within a minute, if they had ulcers or cervical dysplasia, it would turn a milky white color, and that's how you would know there was something going on. And if it's negative, it just looks like a normal red-pink cervix. And so the sensitivity to detect high-grade precancerous lesions ranges from about 66 to 96%, with a median of 84%. So it's effective, but it's not something that we would use in America since we have alternatives. And the median age of diagnosis of cervical cancer in Uganda is 43, and they have a 5-year survival rate of 18%, which is very, very, very low for cervical cancer. And this is just due to late diagnosis and lack of resources.
So another type of quote unquote doctor that we got to see in Uganda was a traditional healer. So through this experience, we got to meet the traditional healer. He is 75 years old, and his job was passed down generationally through his family to him. So he took over this job when his father passed away. So we learned a lot about different conditions that he can treat through using different herbs and mixtures to help people in Uganda. So some of the pre-made herb mixes that he uses to treat can treat medical conditions such as arthritis, bloody noses, allergies, menstrual regulation, malnutrition, and even hiccups. Some other herbs and concoctions that he used could treat other conditions that we in the United States would not consider medically necessary, but he is able to prevent poison, prevent bad luck, and help with man and woman power, which is a type of potion that helps with sexual enhancement and libido. So when he gives the man or woman power potion to a patient, he actually tells them to use it within 3 days, and he himself abstains from having sexual intercourse with one of his wives for 3 days, so that they may have the success with the potion. He also can take his pre-made mixes and combine them to treat any other issue that you might have. He takes any sort of payment and actually will heal anybody, whether they have payment or not. And types of payment include money, food, children, and wives. So what can Carroll do for KIHEFO? So our future in this partnership that we have gained with KIHEFO through our trip last December is providing the opportunity for students to go and return to KIHEFO in this upcoming December of 2020. So the money that you use to go down to Africa, actually most of it goes to KIHEFO and supports the community outreach clinics that you get to do. So the money you're paying pays to help the people that you get to interact with. So a fundraiser that we're currently doing right now with KIHEFO is Carroll Coins for KIHEFO Kids. We are collecting coins to send the money and funds down to KIHEFO to support them during this time. And another future fundraiser that we hope to do is to send toothbrushes down to kids, because they use things such as sticks to chew on to clean their teeth, and they don't have something as simple as a toothbrush. So why should you go down to Uganda and work with KIHEFO? You should go to learn and to experience and to support the Kigezi Healthcare Foundation. Thank you.